So now welcome to Uhuru Dempers from Windhoek, Namibia, also from the Lutheran Church in Namibia, and you're also the coordinator of Big Basic Income Grant Project. I've had the privilege as a reporter to visit Ochivaro 4 years ago, and I'm very much looking forward to this presentation because I think what's happening in Namibia is really, really incredibly interesting. Please, the floor is yours.
Thank you so much for the opportunity and for the invitation to share with you our experiences from Namibia with regards to social protection in general, but also the pilot project that we've been running for a couple of years now. I need to say something before I do my presentation. This is my first time in Sweden, but I have had the privilege of benefiting as a Namibian, participating in the struggle for independence many years ago as a youth and students from the solidarity and support of the people of Sweden. And I want to recognize that. I see my good friend Ambassador Sten Rhinelander here, and I cannot ignore that historical fact and that recognition and support that we've received from the people of Sweden. And I'm seeing this as the continuation of that struggle for a better world. I want to start by giving you a bit of context, talk about our development challenges, then I want to talk about the pilot project in Ochivaro, and then just an update in terms of where our campaign is now at the moment. Now, when I talk about our development challenges, I want to concentrate on the things that we are struggling with. This does not mean that we've not made progress. This progress we've achieved in a lot of areas, but these are really the critical challenges that we have. We are probably the most unequal country in the world, according to the UN and the World Bank. We have a serious struggle with unemployment, which now stands at least 51% of the population, especially among the youth. This is a major crisis, and we've also lost a lot of jobs in the agricultural sector in the past couple of years. Infant mortality is another challenge. In 2010, we lost 6,000 children as a result of this phenomenon. HIV/AIDS is still a challenge with us. Urbanization is a growing phenomenon with agriculture support diminishing, especially to small-scale farmers. A lot of people flocking to urban areas, looking for greener pastures. We have, from time to time, problems with hunger, both in urban but also in rural areas. The land question has not yet been effectively addressed. We still have 4,000 white males owning most of the productive land in Namibia, which has challenges for food security and the whole struggle for poverty alleviation. We have not been able to come up with an effective rural development strategy, especially in the agricultural sectors. And we also face major threats with the recent spate of economic partnership agreements that, especially with the European Union, but also with other partners, lately with China and other blocs. We have high rates of poverty, particular challenges in health, education, and housing, sanitation, this, whereas we are one of the countries that is really blessed with natural resources. We're the fourth largest producer of uranium and the leading producer of quality diamonds. I understand some of our uranium we share also with Sweden. And we have a small population, but with lots of resources, but we're struggling to meet even the very basic needs of our citizens. I want to now concentrate on the government existing social protection mechanism, just taking a few examples. We have, as was mentioned, a universal old age pension, At the moment, it's about 500 Namibian dollars or South African rand for every citizen above the age of 60 years, and we have a very good coverage because it's universal. Everybody, rich and poor, white and black, everybody qualifies for it, and the application process and so on is very simple and straightforward. And then we have the conditional grant, the disability grant for severe cases of disability. We've also some form of a grant for orphans and vulnerable children, and also a recently introduced grant for what we call war veterans, those that participated in the liberation war for independence. So those are the current sort of social grant programs from government. There's also in the private sector and other places contributory schemes where those that are employed contributes to some kind of insurance schemes, whether for pension, medical aid, and other forms, but those normally exclude the low-income workers and are only meant for those that have higher incomes, and majority of the people, of course, are in the low-income bracket. Now, there is evidence out there that the current existing social grants really goes a long way in addressing and helping families, households to cope with survival. When we did the poverty profiles, developing the national poverty strategy, the key question that people were asked about how do you survive, the social grants, the pensions and so on were mentioned time and again as a very key element, a factor that's assisting people to survive. The challenge we have is that the social grants only covers a small population, a small part of the vulnerable group in our citizens. For example, if you look at the whole unemployed youth, there's no social assistance program for youth unemployment, which I indicated is around 60 to 70%. So now the big question that we're sitting with is what happens to those ones that are not covered by the existing social grant programs of government? And that's why we became attractive when this proposal for a basic income grant was made. We feel that as opposed to other interventions, cash transfers can allow people to address multiple needs, and it also gives choices and rights to recipients to be able to prioritize. As was said in the previous presentation, people can decide where to invest the cash that they are getting in health, in education, in improving their productive capacity in terms of agriculture and so on. We are also able to address a multiple socioeconomic rights through cash transfers as opposed to, for example, food aid that we've been using as an intervention previously. It's easier to administer and monitor also, especially if it's universal and an unconditional grant. When you have means testing and so on, it starts to become challenging. And it also equalizes a society like ours that through the tax system you can take from the wealthy and you can really lift up the conditions of the poor. Now, where does this basic income grant idea come from in Namibia? The government set up in 2002 what was called the Namibia Tax Consortium, or NAMTAX, and one of the many proposals from this commission was the introduction of a monthly cash grant of about 100 Namibian dollars to be paid to every citizen as a right. So we as churches and civil society felt that this proposal would cover the rest of the population that is not covered by the current existing social grants, whom I've given some examples to you before. So if you are in a household of, say, 6 people, that's the average size of a household in Namibia, you'd have about 600 Namibian dollars, $100 given to each individual, and then you can put it together and help to meet some of the basic needs. The very important factor here that the Commission also mentioned and that we've been emphasizing in our campaign is that the funds, the money that is given to, because it's a universal grant, but the money that is given to the well-off is going to be, the wealthy is going to be taken back by government through a moderate increase in the tax system. Once this recommendation was given to government, there was a complete silence. Government was not eager to take on this proposal, and in 2005 we formed the Basic Income Grant Coalition, which consists of the trade union movement, the churches, NGOs, youth organizations, and organizations dealing with orphans and vulnerable children. After 2 or 3 years of discussions and debate with government, we decided to put the idea to the test and to come up with a pilot project. And the village of Ochivero, which is about 100 kilometers outside of Windhoek, was selected as the site for the pilot project. What we did before the start of the pilot project is to do a baseline survey to see what's the status of the community, what are the indicators in terms of health, in terms of education, employment, the situation of hunger, access to basic services, and so on. And then we came back after 6 months and after a year to look at whether there's any changes that's taken place in the community. We also did some key informant interviews with key, like the sister at the clinic, the principal, police, and key people in the village. The research was done by local researchers from research institutions, but also was backed up by a team of international researchers. What follows is really going to be some of the results that we found from collecting data after the 6 months, after the 1 year. I'm going to go through this quite quickly, but you can pick up a leaflet later on during the break there, and there's some very detailed information provided. The challenge in the baseline survey that we noticed from this village was really the challenge of hunger. Poverty manifesting itself in various forms, but hunger because of unemployment, because of a lack of a livelihood, was really the main challenge that this village was facing. And we saw very quickly in a period of 1 year, these figures really coming down. A severe hunger because people now had some cash, they could access food and other means to be able to address their basic needs. What we also saw was a migration from, because as I mentioned, this village is 100 kilometers from the capital city. We also saw a migration of especially family members of these villages coming from the big city, Windhoek, to live with the family, because now these families were considered well off because they have had a bit of cash and they could be able to afford food and the basic needs. So the families from the hunger in the city came to share with theirs. In the area of education, we saw increased enrollments at the school. The school, in fact, had to build 2 more classroom blocks to be able to cope with the demand for education from the village. Kids from the nearby commercial farms came back to school to attend school. We saw a better academic performance among the school children. We saw school fees being paid. Unfortunately, in Namibia, although it's a constitutional provision that education be free and compulsory, especially in primary education, government has still insisted and charged school fees, and that has also held back some of the poor children from accessing school. But in this village, because of the basic income grant, we've been able to see more kids accessing education. The payment of school fees has also made the school, the teaching and learning environment enabling, and those resources that are not provided by the government, the school was able to acquire itself. And therefore, access to education has really been addressed. We've seen increased visits to the local clinic. There's a service fee that is payable at the local clinic when everyone visits the clinic. And before the start of the pilot project, the income at the clinic was about 250 Namibian dollars, and we saw that jumping to about 1,300 in the period that we did the assessment. So we saw that people were able to access local health services, whereas sometimes they had that constraint because they did not have the means to pay for the for the fees that are required. We've also seen the basic income grant complementing government efforts. Government is providing free ARVs for HIV/AIDS treatment, and with the basic income grant, people are able to at least consume something before they take the medication. So we saw really the grant complementing government efforts, which is not happening in other places. We've also seen the challenge of child malnutrition almost eradicated in this village. I remember a day we took members of parliament from the Namibian parliament, and they spent a whole day in this village, and they visited the clinic, and the nurse there was boasting that the issue of child malnutrition was really eradicated from this village. She in fact mentioned 2 examples of a case she had a month ago in the village, and mentioned that she knows those families very well, and those kids were in fact from the capital city, Windhoek, and was joking with the MPs and saying, please take care of your kids. We are trying to take care of our kids here in the village. We also saw a lot of backyard gardening taking place. People, it's really, one has to understand the location of this village to understand it's sort of in the corridor of commercial farms, mainly foreign-owned commercial farms, and people don't have access to land, so they can't engage in large-scale agricultural projects or anything. So the little plots that they have in the village, they are able to grow some vegetables there. And the grant was also able to facilitate people really diversifying their diet and taking in more nutritious food. They had now the choice in terms of intake. The most important investment I think we have made in this village is that the village has really became alive. The people, contrary to beliefs and critics saying that social grants creates dependency and laziness, we saw the complete opposite happening in this village. We saw people starting small businesses. We saw people engaging in productive activities to complement their income, the small grant that they are getting. We saw people buying livestock with these grants. We saw people buying and selling things. There used to be only one shop which is owned by a white farmer in the area, but now there's about 6 or 8 small shops that is opened up in this village, and people were also able to engage in retail. So some of the funds are also really been invested in the village itself. Some of the young people were able to use this grant to go to the cities and look for a job, and a couple of them were lucky to find some jobs like being domestic workers and so on. So the grant really created opportunities. Here's a grandmother which, with the resources she got through the social grant, was able to buy some material and make some dresses to sell in the village, but also outside of the village. And here she's saying that mainly she's using the income to send her kids to high school, because there's only a primary school in the village, and it's very costly to send kids outside of the village to a high school. Here's Frida, which has started with a bakery when she got the grant. First just digging a hole in front of her house and baking bread there. Later on buying a small stove. Now she has a bigger stove and is supplying the village with bread, and is also complementing the small grant she got, complementing to generate more income for herself. We've seen incidents of crime dropping significantly. This village, because of its location, because there is a lot of unemployed youth in this village, they would go over in the fences of the commercial farms and collect firewood or engage in illegal poaching, because they're hungry, there's no other livelihood. So there would be a lot of what we call economic related crimes in this village, and we saw this dropping significantly. These statistics like the crime, like the health, the education, those are statistics that government is keeping. Those are statistics that we get from government offices. This is not really, we're just confirming what government is collecting. This is crime reports that we're getting, for example, from the police station and so on. We also saw, because people were able to open small businesses, because people were able to generate in productive activities, the number of unemployed dropping, and people, when they start small businesses, not only employing themselves as the owner, but also having shop assistants and so on, therefore creating job opportunities in the village. The big debate currently is whether, as a country, we can afford the basic income grant, and we have done our calculations with the assistance of a number of well-renowned economists. We've also done some simulation exercises to see what the impact of the grant would have on the local economy in the village, but also if it was implemented countrywide in Namibia. And what we are saying is that the grant is really sustainable. What is not sustainable is not to do anything and to leave those 60 to 70% of unemployed youth without any means of survival or any kind of support. We support that there is scope for minor adjustments in the text, but we feel even the current resources in government coffers is able to implement the basic income grant. We look at the population of 2 million, and then what we think the 666,000 is people that are working, that are in a certain income bracket, and therefore need to pay back the basic income grant through a tax system. And then we also have the old age pension. If you deduct that, you get about 1.2 million people that would need a basic income grant, and that's less than 6% of our national budget, and therefore we feel that our government can implement a basic income grant. Just to conclude, these are some of the strategies that we've been using to lobby government, a continuous dialogue with government from president up to members of parliament, councillors, traditional leaders and so on, public mobilization, media advocacy, but the pilot project really has been a major strength in our advocacy work. And now the major focus is really to mobilize people so that they can be able to demand for a basic income grant themselves. We also have linkages with through the BEAN network internationally, in SADC on the continent, through various platforms, and influenced and encouraged by those experiences worldwide. Thank you so much for your attention.
Thank you so much. Just a comment, one of my strongest impressions from visiting this village of Chivaro, talking to the nurse, was that, of course, the effect that you were talking about with the malnutrition almost being eradicated was that the children literally began to grow. I mean, the children who were not growing year after year began to grow. And also that a lot of those people were victims of those white farmers who would, and we'll talk about this later in the debate, because there's huge amount of opposition and a lot of aggressiveness, a lot of death threats against the people who are working with the big project, because the white farmers used to be able to come by the village and just pick up people to go out and help mend fences and pay them next to nothing. And now, of course, people could say, no, thank you, I have better things to do. You know, I am running my own small business, or I'm tending my kitchen garden. So the conflicts, and also we'll talk a little bit about problem with alcoholism, and so I mean there are issues. And also I want to say that we will open up for questions from you all too when we have the panel, because I'm sure many of you have a lot of thoughts after this interesting presentation. Okay, thank you very much.
Thank you.
We now have 10 minutes just to stretch our legs. There's some water and fruit in the room, and then we will continue. Thank you.